Hi, welcome to Unique Parenting. I am B. Moise, and today we're going to talk about managing negative or difficult behaviors. So, how do you manage unwanted behaviors, bad behaviors, or any type of behavior that you don't want to see when you're a child? First, let's talk about who needs to know how to manage difficult behaviors. And it's basically going to be anyone who has interaction with your child. So parents, grandparents, siblings, caregivers, teachers, babysitters, you name it, anybody that's going to have contact with your child should definitely know how to manage those particular set of behaviors. Now, behavior is basically anything that you do. So blinking is a behavior, walking is a behavior, anything that is done, it's any action. However, negative behaviors are, tantrums, hitting, biting, screaming, kicking, self-injurious behaviors where, a child is hitting themselves, biting themselves, hurting themselves, or destroying property. So anything like, hitting a wall, kicking a wall, doing anything like that. So those are negative behaviors. Some behaviors are typical, some behaviors are normal. And to determine that, it's going to be based on the developmental need of that particular child and the developmental milestone that that child is particularly in at that moment. So, and some behaviors do help children learn. So they're a part of growing up, they're developmentally appropriate. So if you want to decide if it's a good thing or bad behaviors tend to last longer than they need to be. And they seem to be no endpoint to it, where typical behaviors are short-lived. It's just kind of like a temporary little blip in the matrix of a child, and they get over it. So they're short-lived if they're typical or normal behaviors. And if they're abnormal behavior, they tend to last a little bit longer, and they seem to have no endpoint to it. What causes negative or unwanted behavior? Well, usually when a child is in some type of emotional pain or turmoil, bad behavior is the easiest way to make it go away. So if a child doesn't feel well or they're not in the state of wellness, physical or emotional, they're going to act it out. So they're going to hit, kick, scream, run, anything that you can think of. And if you have a verbal child, they're going to say bad words and things like that because inside they're not feeling well. So they want their outside to match their inside. And that's usually where negative behaviors come from. And when a child does a bad behavior, it usually leads to attention. And that attention, good or bad, tends to calm that child down and it makes them feel better. So while it may not be the best way to approach it, it is definitely a way that they thought could be effective, and it's been effective in the past, so that's the reason why they continue to do it in the moment. And emotions come from, the brain. So basically, they don't have that much control of it. Remember, children don't have their frontal lobe development fully developed yet because they're still growing. So they don't have a good control over, when to calm down or how to calm down. If you have an atypical learner, a child with neurological differences, they definitely don't have that skill set because there may be a deficit in that area of the brain. So they really have a hard time with controlling and regulating their temperament, their emotions, their outbursts, and anything like that. And it's not their fault, but so you do have to figure out that it's not their fault. What is it that you can do as a parent to make it better? Yes, most behaviors are learned. So what does that mean? Your child did learn that having a tantrum, kicking, screaming, having a fit, or whatever it may be, worked in the past. So because it was successful previously, they're going to attempt it again. And even if it was not successful the last time, but then you took a break and then they did it again and it was successful, they're still going to remember that last successful attempt. So that usually is the reason why kids do something even though that it's bad. It's because it's learned from previous experiences and it was successful. Negative behaviors is a maladaptive coping mechanism, meaning like it is just something that the child did not learn properly. It doesn't matter how old your child is, whether they're 2 or 17. If they have an underdeveloped coping mechanism, it's not going to reflect their chronological age. So it truly doesn't matter that they're 16, but if they don't know how to cope properly in the time of distress, they're going to act like a 5-year-old. And usually delayed coping mechanism is a cause from, inability to problem solve, delayed emotional response, lack of self-regulation or delayed communication skills. All those things cause maladaptive coping mechanism because there was an issue there. Typically, there's a big correlation with executive dysfunction, meaning that if in a normal developing brain, a child can calm down and respond correctly and and have a conversation with, hey, this is not what you want to be doing right now. Let's kind of take a step back. But if they have executive dysfunction, that is a harder thing to do because they don't have access to that part of their brain to successfully navigate this emotion. So again, just be mindful that this isn't a purposeful, intentional thing. There's a lot going on neurologically that is, impairing this child with the inability to manage this type of behavior. So what's the plan, right? Like, in order to be successful with any type of plan, you have to understand the first part, which was that this is not something that they're doing on purpose. They're neurologically wired differently. They have an atypical brain. There's other causes and reasons behind it. It's a maladaptive coping mechanism. Once you understand the why, then it's easier to, treat. It's easier to now manage it. The number one thing to do is you always have to create a cohesive parenting plan. So a cohesive plan in general, where everyone who is going to be around this child is on the same page and understand that the goal is the same and you all want to do the exact same thing to get the same outcome. So consistency is a huge part. If you're cohesive, you're going to be consistent. Do not give in to demands or negotiate. It's really easy to start to negotiate with the child, if they're tantruming, like, if you stop doing this, I'll give you my phone for 5 minutes. And the child could say 20 minutes and you're like, 8 minutes. That's negotiation. You have to set your boundaries, set your rules, set your law. And if 5 minutes is what they get, 5 minutes is what it is. So don't negotiate. Ignore unwanted behavior. Now, that is if the behavior can be ignored and there is no safety or harm that could be done while ignoring this child, because you can not ignore a kid that is jumping off, the countertop or something like that, because there's safety there. But if it can be ignored, meaning, screaming, crying, whining, or anything like that, you want to ignore it. And when that child calms down in that moment, you immediately reinforce the calming down. So you immediately go to the kid and say, hey, I see you calm down. What is it that you want? What do you want to communicate with me? And always give options. So in that moment, the child may not be available to tell you exactly what they want, but they can take into consideration certain options. So you can say, like, hey, do you want a snack or do you want to sit down? Do you want to go outside or do you want to go for a walk? Give them options of 2, just so they can have something to pick. They may say, I don't want anything, or scream or whatever. It's like, I don't want anything. No, no, no. And say, okay, that's fine, but I'll be back when you're ready to make a choice or a decision. So that is reinforcing the desired behavior, which is communication. That's what you want. You want to make sure you're reinforcing hey, you're in emotional turmoil and you may not have complete access to the ability to communicate well right now, but I'm going to reinforce your attempt to communicate well. And sometimes it's just best to remove either yourself or the child from the situation in general. So maybe it's going to their room, and I like to think about going to their room not a punishment, but a time to reflect or a time to really just calm down. It's not go to your room and and stare at the wall, or go stand in a corner or the stairs or anything, where the child is just really bored and thinking about how do I get out of this? But really giving them a proper coping mechanism. So if they go to their room, they have something to do in their room to help them calm down. It might be a sensory need that is unmet. So if they go to their room or another space where they could draw, they could color, they could paint, or they could jump, or anything like that, that is sensory fulfilling, that is a more effective and appropriate way to teach them how to manage their own behavior. So that's how you would remove them from the environment. Or if you're having a hard time and you're having a difficulty managing this, it may be best for you to remove yourself from the situation and think about, you know what, I'm not dealing with this right now and I don't want to respond incorrectly, so I'm going to remove myself and then re-enter when I can. When the child is available, when the child has calmed down and you want to talk about it, you want to have a conversation about, hey, what went wrong, what we could do differently. Be very specific with your directions and instructions with what you're talking about. Use language that is developmentally appropriate. So again, if your child is 10, but developmentally they're more like a 5-year-old, you may want to use language that mirrors that instead, just because it's the 10-year-old chronologically may not be a 10-year-old developmentally. So just be mindful of that. Give one-step instructions or direction at a time. So I want you to do this, and then just leave it alone. Like, next time I want you to do this. Leaving conversations short and concise so that the child is not overwhelmed with too much talking. And disciplining less is more. So you want to use fewer words, but give options. Demonstrate some of the things that you want them to do. If you say, I want you to clean your room, and their room is a complete and total mess, and that caused a breakdown, and now the kid is kicking and screaming and doing all these different things, which causes a bad behavior, show them what you mean by clean your room. You may have to do this a couple of times before they get it. If you want them to help you, if you want them to, whatever it may be, if it's possible to demonstrate it, do a demonstration first, followed by, hey, now it's your turn. Again, it doesn't truly matter the age of the child. Some parents assume, well, you've been watching me do this thing for 10 years. Why can't you do it? They have not been watching you doing this for 10 years. You've been doing it, but they may have not been actively paying attention to what's going on. So again, demonstrate it so that they have an idea. Use visual aids. Most atypical learners, kids with unique brains, they do really well with visually seeing things instead of auditory picking it up. So sometimes words get lost in that process. So if they see it in a visualization, it's a lot easier to execute. So use visual aids to help. Create a routine so it's consistent. Like if you want a child to do chores, to clean their room, to make their bed, to brush their teeth, to get dressed, whatever it may be, create a routine around it and make sure that routine is being executed daily, including the weekends and even on vacations or time off. A break in their routine may create a disconnect for the child. So until they have that particular skill set, manage, or until they have it mastered, they're not going to be able to execute it. So when the skill is mastered, then yeah, you can skip holidays because they can pick right back up. But until that skill is mastered, you're definitely going to have to create a routine to be consistent with it. So that's how you help a child manage negative behavior. Again, understanding the why behind it, where it's coming from, how as a parent you can respond to it when it comes on, meaning like, oh, is it after I ask for a task? Is it after the child is tired? Is it around bedtime? Trying to figure out. Once you get the where, when, and how, it definitely creates a better dynamic to how you can manage it. So those are my tips for managing difficult behaviors. I am B. Moise. Enjoy your unique parenting journey with your unique child.